Its title is TrumpCare, Lies, Broken Promises, How It's Failing, and What Should Be Done. And I had a lot of fun with this because Trump has so many lies, like over 5,000 now with the Washington Post, and so many lies about healthcare that I sprinkle them through the book. But on the cover, I have, he said this about, well, a couple days after inauguration, we're going to have insurance for everybody. People can expect to have great health care. It will be in a much simplified form, much less expensive and much better. That's what he told the Washington Post. Can you still hear me?
Yeah. Yeah.
Okay, so let me give you an idea of what's in the book. It's got 4 parts. The first is historical perspective, and part of that part is how healthcare policy has been for sale to the highest bidder for years and years, and includes a section on how the Affordable Care Act was corrupted by outside money. So the second part is what is TrumpCare, and of course, we all know that all the sabotage the Republicans and Trump have done to the Affordable Care Act, they now own it, so it's sabotaged. And in that section, I talk about shifting health care to the states because that's a big part of their policy, no matter what the adverse consequences. And a third is increasing privatization, as we know, both Medicare and Medicaid, and elsewhere in the system. And the fourth part I deal with is loss of patient protections. As we know, they deregulated insurers and killed the patient protections out of the Affordable Care Act. And I deal with deregulation of care, also healthcare. So, and then the next chapters deal with how TrumpCare is failing, which includes declining access to affordable care, inadequacy and instability of coverage, lack of cost containment, profiteering and lower quality of care, increasing bureaucracy, corruption, waste, and fraud. And I document all that, including with references up just about till the end of August. And the book came out in mid-September, so it's really updated. My last section is to summarize the current crisis in our healthcare. And this is a little over a year since my previous book, and so much happens in a year that there's a lot of new stuff. And then I go to TrumpCare versus, we have just 2 options now. TrumpCare, the Affordable Care Act is no longer an option. It's all sabotaged, and it's TrumpCare versus single payer for all. Those are the 2 options that I deal with without anything in between, I hope, but I'll come back to that in a minute. And then I have a chapter on winners and losers under TrumpCare versus single payer. And then the last chapter, how can healthcare be reformed? Maybe by 2021. That's the best case if we were successful in Democrats to take the House, and if the Democrats don't wimp out for the 2020 platform and elections, and ideally if the Dems can get the Senate back. So that's a really tough act to pull off, but that would be the soonest we could see it, I think, is January of 21. But hopefully this coming midterms will be a really big deal and hopefully a big blue wave. So anything's possible now. But let me deal with, as we know that healthcare is actually the top on a bunch of polls issue on the electorate's minds, namely unaffordability and decreased access. It's way up there, even a bunch of polls above the economy. So we know that. And there was a piece by Trump in USA Today a few days ago, and that was just one lie after another. And he's come out completely against Medicare for all, of course, and all kinds of disinformation and claiming it'll cost almost 33 trillion in the first 10 years, but he ignores all the offsetting savings for individuals, employers, or state governments. And he claims that Medicare for all would take away benefits from seniors. Then he goes into, he really wants to protect coverage for patients from pre-existing conditions, but no, he's trying to kill it at the same time, supporting a lawsuit that would kill that. And then he's taking credit for premiums coming down. Well, the insurers hiked premiums big time in the last year or two, and they've been very happy going to the bank and the S&P 500 and on Wall Street, the healthcare sector is the highest it's ever been, the insurers are now boosting their profits for early 2019. I mean, they're just ripping us off big time. And the trade-off is they sell more crummy policies and non-insurance, these short-term policies, which Trump lets them. Obama had those at a max of 3 months, but Trump let them have it all the way up to 364 days, and they can be renewed twice, 2 more years, and they will cancel out any of the ACA's 10 essential benefits. So these short-term policies will have basically no maternity care and no mental health care, and maybe not hospitalization, and maybe not coverage much of prescription drugs, and on and on and on. So to claim that premiums are coming down is very disingenuous. And then Trump's people, Seema Burma, is big on let's privatize much more of both Medicare and Medicaid, and Gaze over there in Health and Human Services keeps talking about their program increases people's choice, but decreases the value of any coverage. So we're filled with disinformation and lies, and it's going to be very confusing to an electorate here in just 3 weeks, and for the 2022 or also. So that's for openers. Can you hear me still?
Yeah, very good.
Okay, that's good. So, well, it's obviously a recurrent battle. It's got a long history between corporate interests and healthcare. Healthcare is a commodity. It's not a service. It's not for people. It's for corporations and all for profit. I want to mention many of us don't realize how privatized we already are, and it's an interesting list based on the latest information. The extent of for-profit ownership in our medical industrial complex. Freestanding lab and imaging, 100%. Surgery centers, 96%. Dialysis centers, 90%. Home care, 76%. Nursing homes, 65%. Hospice, 63%. Specialty hospitals, 37%. Inpatient psychiatry and substance abuse, 20%, and increasing, by the way. All this tends to be increasing. General hospitals are still down only at about 11% privatization, which is kind of interesting. So So that's where we are now. The current crisis I go into later in the book, and as you can guess, inadequate access, a big deal. There are 29 million uninsured right now. Remember, it was 50 million or so before the Affordable Care Act, but it's projected to go to 32 million in uninsured in 19 and 41 million in 2025. So that's not much better than when the Affordable Care Act came on. But beyond that, we have tens of millions underinsured. And when all this hits with these short-term plans and these other crummy plans, there'll be many, many more than that underinsured. So, and then community health centers have been decreased funding. Women's health care has seen lots of funding cuts that restrict women's choices. The proposed rules would forbid federally funded family planning clinics from referring women for abortion. There's been big changes in Title 10, the family planning program that serves 4 million low-income people. The GOP wants to defund Planned Parenthood, and a bunch of states are trying to do that. And children's health care, CHIP, has been cut. Mental health care has been chopped a lot, and it's already a disaster. Mental illness has been criminalized to a big extent. Many mentally ill people are in the jails and without treatment. So psychiatry is a disaster right now. All that plus increasing disparities in our population, unaffordable costs. The latest Milliman Medical Index tells us that the average employer or the average family now pays $28,000 a year for health care or insurance programs, a family of four, cost sharing and foregone wage increases. And the median income in the US is about $59K. So these are just obviously unsustainable. And then inadequate quality of care. There's a lot of stats like that. And you're familiar, I'm sure, with the Commonwealth Fund in New York City. They've done international, cross-national studies for years and years now, comparing us with 10 other countries, including Western Europe and Scandinavia and New Zealand and Canada and Australia. And US comes out at the absolute bottom in almost everything, from access to quality of care to equity, all that. So, and then beyond that, the current insurance market is very unstable, very volatile. It'll get more so as we see what the states do, and they're asking for waivers right and left to get away from patient protections, et cetera, et cetera. And then coming down to the safety net's really falling apart. It has very much so, and since Trump came into office, and it's headed to falling apart much more. Look at food. There are 41 million Americans that are, quote, food insecure, where they're not sure where the next meal is. This is incredible stuff. So I go through that and go through the latest on what's happening with Medicaid, which varies hugely from one state to another. It's very difficult, especially in southern states and some others, to get eligible. I think the eligibility level, if you make more than something like $3,500 a year, and I think it's Alabama, that's making too much to get qualified. So stuff like that. So I don't want to go on too long, but let me comment on the winners and losers, and then let me come back to the differences between the House bill and the Senate bill for Medicare for all. But so if you look at winners and losers under TrumpCare, the winners are large corporate mergers, private health insurers, obviously, the drug industry that keep avoiding any negotiated prices and keep preventing us from importing from other countries. And you see the fight right now that they don't want to put their prices on their ads. And shareholders are winners on Wall Street, and lobbyists are winners. The losers are patients with pre-existing conditions, chronic illness, women, mentally ill, early retirees, and the elderly. The newly uninsured and underinsured lose. Medicaid beneficiaries will lose through cuts and privatization and insurers being able to charge more for health risks. And rural hospitals lose. A bunch of rural hospitals are closing in the last few years, and that will increase, and taxpayers lose. So compare that with winners and losers under single payer Medicare for all. Winners, all Americans, physicians will win, other health professionals will win. The student AMA now has a group that are for single payer, and they're trying to move the AMA in that direction. Nursing has been very strong. The national organizations of nursing are very strong for single payer. Hospitals will win because they can be reimbursed on a negotiated basis and have a steady plan for the future. Employers will win by getting rid of the burden of providing health insurance, which a bunch of them more and more would be glad to drop that. And mental health care will win, public health will win, federal and state governments will win, and taxpayers will win. The losers, private health insurers, corporate middlemen, corporate stakeholders, privatized Medicare, privatized Medicaid, displaced workers, and lobbyists. But there is money, as you probably know, and HR676, as I remember, is 50, I forget the exact number, for retraining of displaced people who have been in the insurance sector or other parts of the system. So that's part of the plan. But it's just so obvious to everyone in your room and here that it should be a no-brainer to get to single payer, but it'll be a dogfight, as we know from the great study Jerry Friedman a few years ago. Will save over $600 billion a year, save over $600 billion a year as soon as we enact 676. And much of that is from getting rid of the insurance overhead and administration and all that bureaucracy and waste. And a bunch will be through bulk purchasing and negotiate of drugs and reform along that line. So we'll all win. As to Bernie's bill in the Senate, well-intended as it is, and I know he's got a tougher road with Medicare for all than in the House. We have, 122 House representatives for Medicare for all, for single payer, in fact, as I understand it. So that's really going to increase, I think, too, after the midterms. The Senate is much tougher, but And I'm sorry to see centrist Democrats talking about, maybe we should do the public option again. Well, that was killed a few years ago and wouldn't have worked anyhow, and it's not going to work this time. Or letting people buy into Medicare, say down to whatever it is, 55 or 6, whatever. That's not going to work either, because as we know, we need the big risk pool. We need 320 million Americans in the risk pool. And then we can all share the expense for the whole system, and it'll be much more simple. By the way, I was in practice in Mount Shasta as a family doc in the 60s for 6 years, during which time Medicare and Medicaid passed. And I can tell you that it was not disruptive at all. It wasn't even questioned that much by the people that put it in. And it was seamless. Patients would come in and they have their new card, and that's it. So one of the disinformation things now that the opponents of Medicare for All will say, oh, it'll be too disruptive. Well, it will be for the insurance industry. but for all of us, it's the only way that we're going to get back to affordable care for everyone, and the only way we'll have a real safety net. So I gather that your group is working towards disabusing people of Bernie's bill for a good reason. They will, it's a longer time to bring it about. They would continue payment systems that have been proven not to work, the pay for value of care and like that, and which is being pretty much discredited if you look at it. And it would continue privatization and continue for-profit healthcare system, not going to a not-for-profit system. So for a lot of reasons, I think HR676 is obviously what we need. I hope the Dems can take the House. I hope centrist Dems don't block real reform. And I hope down the way that we can get the Senate to go along. But the much better bill is the House bill, I think. So let me stop there and try and deal with or respond to any questions that you have.
Okay, we're going to turn the lights on here and pass the microphone around.
So my question is, when Medicare was first instituted,
Yes.
I worked for a hospital, and we had a lot of very awkward system to go through. We had to submit bills to the government, and they weren't even bills. It was a request to bill them, and then we had to wait 6 months or more for a response, giving us permission to send a bill, and then it could be 6 months to a year before we finally got payment. And I'm wondering if when we instituted HR676, we would go through this huge payment delay. And I'm wondering if you have thought a little bit about that.
Well, I would hope not, but who knows? The whole billing and reimbursement system would be much simplified and hopefully would be much better. I can tell you now that physicians get paid quicker and better by Medicare, as I understand it, and other health professionals than through private insurers, and that's right today. But yeah, it's going to be, well, HR 676 will simplify from, it's just crazy now. I mean, billing is just, it's off the charts right now. The whole game by hospitals and other parts of the system is to upcode for more reimbursement and with sometimes diagnoses. I mean, some insurers even search the charts to find diagnoses that weren't taken, looked at the last visit, but increase that way too. So it's just awful what we've got. And yeah, it depends how clean and how well the leadership is and the accountability politically as to what really happens, how long. But in practice as a doc, I found it fine in 65.
We just, several of us, delighted to buy a copy of your book just now, and I took a quick glance at it, and just a minor suggestion. If we go to page 246,
246.
table 16.2,
Yeah, got it.
this, a lot of us at UW were doing research, and we argue that one great benefit of universal health care single payer would be the potential to do population-based epidemiology, which is essentially impossible right now, given the multiple domains of private insurance companies and the lack of the uniform electronic base. So I would maybe put that a winner would be biomedical research, because it could inform us about basic issues of research and causes of disease and so on. But you were in a
That's a great idea.
it's part of public health. You have public health as a winner.
Of course.
Biomedical research would also gain a great deal from an integrated national electronic database.
I agree, and I should have done that.
Yeah, and a question I have before I turn it over, David and others are going to meet with a representative in Congress.
Yes.
Pramila Jayapal.
Yes, yes.
He wants to introduce features of Bernie's bill
Yes.
into HR 676, which we're against. And the question I have to you, what would be the most cogent argument to present to her as to why this is not a good idea to integrate the two bills and introduce features of Bernie's bill into HR 676?
Well, HR 676 is very strong as it is. And we don't want to see privatization. And we want it to be a tight system and redesigned. And we want the ethic to become service-oriented and not profit-oriented. So Bernie's bill is a little bit looser on some of that, it seems to me. And again, there'll be all kinds of pressure, political pressure, to not deal with the real problem. But the real problems are pretty obvious, and they're getting worse. And people just cannot afford care, and huge numbers are foregoing care. They go in late. They have worse outcomes. I'm actually considering one more book project in another year or so, which will be suffering and dying under TrumpCare, and long gone the safety net. I mean, the safety net a year from now, even a year from now, if Trump is still in there, is going to be much worse than it is today. We haven't seen anything yet. I mean, and the more we move to the states and give more state waivers, the worse it's going to get.
I'm asking about the problem of 676 failing to address the repeal of the Hyde Amendment
Oh, yes.
and give proper attention to women's health care and
Yeah.
to address that. And I think it's relevant to this upcoming meeting with Representative Jayapal, who obviously would be concerned about women's health care. So I
Right.
wonder if you have any thoughts about, we know that absence from 676 and what should be done.
I think that would be a good addition to 676. And I've seen some to that effect that would give women full choice of their reproductive health.
My name is Andrew Wellens, and I'm a vet who uses the VA, which is why I know universal healthcare works.
Yes.
I've been using it for over 10 years. But not only that, I was in Scandinavia this year. I've been to Norway, Sweden, Denmark. I was in London, I was in Amsterdam, and they all love their healthcare. And it's funny, so this is going to lead to a question of messaging, because I see right now with Paul Ryan, he just like blatantly lied. He said, oh, Medicare for all is Medicare for none. And then there's the absurd thing that Trump just put in the USA Today, which was just so absurd. But I think this messaging campaign is something that we can win. When I was in London, I met a man who loves the NHS system of London. He sells medical equipment. And he said, because of how England does that, it actually makes it more competitive. Like the government gets the best deal. They have like 25 different competitors. And I think we have to focus on that, because like the Republican talking points are things like the free market. So they shouldn't be scared of a public option. You know, they always want to destroy this, well, and Democrats too, of course, certain Democrats. But from what I understand, like what Medicare for all is up to 70% of the American population now is for it, right?
Yes.
Yeah. And so when I was in Denmark, last month I said, you know, there's a stigma about socialism. And the funny thing is, the Danish friend, he said, it's not socialism. We're actually, they don't even call it socialism there. They say it's a democratic system. So I think maybe one way to beat the fox, because they keep saying that this is like a Venezuela. That's what Trump said. If we do Medicare for all, we're going to end up like Venezuela. And I think maybe one way is just to say, no, we want the Nordic system. You know, because they have their lifespans are longer. You know, I don't know. Going forward with this, trying to win the message. Do you think this is like clearly they have to stick this? Like Paul Ryan he's lying so hard right now. Like, do you see that as fear? Do you think that's because Republicans are scared that the political will is just going to really turn the tide?
I think Ryan is on his way out, and he doesn't know anything about healthcare, and the opponents, the GOP, will bring the socialism argument right up there, of course, but they don't really understand what socialism is really either. And 676 is not socialism. But it is putting health care available for every American, regardless of age, and sharing the risk that we're all going to be patients a number of times in our lives. And those unlucky enough to have a major illness or cancer or this or that, we're not going to be able to afford it. We see that right now. And then the Canadians don't want to change their system. That's the national hero up there who started that in the 70s. My wife and I met a guy in Amsterdam. We were on a brief trip over there a couple years ago, and he showed us his card, simple card, where he can go anywhere in Western Europe for first contact care and regular care. There's a story about an American who goes to London and has his heart attack there and is hospitalized in a very good London hospital and 5 days there, discharged, doing well, goes down to this very small business office on the main floor and asks what he owes. It's nothing. Can they help him get a taxi? I mean, it's absurd where we are in this country right now. Yes.
As far as, obviously it's going to probably come to the way of Democrats. I mean, the thought of like a single Republican going for it is, I'm sure, like, we can't count on that. But as far as persuading Democrats, what do you think of the argument of telling them that the current system we have now is truly unsustainable? That like if there is a disaster on the horizon, the current system we have now, there's a disaster on the horizon, right? Because once they start pulling the final threads of Obamacare, it's just going to be a downward spiral, right? Like this is, like as a nation, like they're really, I see it, and I'm curious, there's a disaster on the horizon for us with our healthcare system. It's just going to get worse until it crashes, right?
Exactly. It's totally unsustainable right now, and it's going to get more so under TrumpCare. Quickly. Wait till the states do what they're going to do with the safety nets. The safety net is decimated.
Do you think we have to worry about the Supreme Court as well once we get it to if it could even pass the Senate now that we have this more conservative Supreme Court?
I hope not. I'm sorry that this latest guy got there.
I am insured through my husband's federal employees health benefits program for retired judges.
Yes.
We pay, the premium comes out of his pension. Our
Yes.
Medicare comes out of our each of us out of our Social Security. So we tend not to notice those. The government is paying $1,000 a month for the two of us to Federal Blue Cross Blue Shield. And in return for that, we hardly ever pay anything except glasses and hearing aids and teeth.
Huh.
The point I'm making is that that's the kind of insurance the 9 justices of the Supreme Court have. So they may not feel very personally engaged when it comes to protecting Medicare for all if we were to enact it, and now they're getting Medicare for all. It may be more difficult to persuade them that that's a good idea.
Mm.
The other thing I wanted to mention to you is we're currently in the United States spending $3.3 trillion a year on healthcare.
Right.
Every single penny of that comes out of our pockets one way or another.
Yep.
That's a really useful thing to be able to say to the public who say, oh, Medicare for all would be too expensive. No, it wouldn't. It's a matter of redirecting that 3.3 trillion and also reducing it. Anyway, I just thought that was something that you might be able to use that sometime.
Yeah, you're right on. I mean, the overhead of the private insurers is 18 or 20%, and then they want it higher. They have more and more sneaky little ways to game the system every year. And it's about 2.5% for traditional Medicare, the overhead. And with the new Medicare for all system, maybe it goes to 5%. I don't know, but we will have huge savings, and that's what the opponents disregard.
I had a question from your book on Obamacare. I read it a couple months ago, and I was trying to persuade this politician or whatever, but you said that currently under Obamacare, it's costing the taxpayers or something along those lines. Can you elaborate on that?
Yeah, I mean, it's been sabotaged, which goes into this book. And it was not adequate when it was passed in 2010. So it was an attempt, but even Obama now comes out verbally, let's go to single payer. He has said that in the last couple or 3 months.
Only he couldn't do it when he had power, right?
But I think the point in your book, though, you're saying that, and this is what I think I mean with my question, like we, as taxpayers, we are subsidizing, in order for Obamacare to work, we're subsidizing it, so to speak, right?
Yeah, we're paying much too much for it. It didn't come down hard on the insurance industry, and the insurers are having a fine time with it, gaming it, and with the current Trump administration, they're making all that privatization worse and deregulating everything and shifting it to the states. Well, the states can't do it any better, and I go into that in some detail in the book. They'll just make it worse. It's chop, chop, chop on the safety net, and people will wake up. But the problem is, Citizens United and how much money is in politics, and that's the second chapter of the book. How the highest bidder gets the system they want. And so it's a cultural, societal problem, a fundamental one, and a huge problem of too much money in politics.
Medicare for all system, do you think we're more likely to get it at the national level and not the state level, or which way do you think?
I think it's going to happen at the national level. I know in Canada, it started in Saskatchewan, I guess, and about hospital care, then spread across the country to the other provinces. And so that has some precedent in Canada. But here, there have been efforts in Vermont and where that was moving along until that was shot down. California, it gets up to the state assembly and Senate, but it's not going to work. But the problem is, and Don McCann, who knows more about healthcare, I think, than virtually anyone in the country, if you don't get, by the way, his quote of the day, don@mccann.org. He has a regular quote of the day, which is fantastic. It's a graduate course in health policy, but he wrote a paper a year or two ago describing how it's not going to happen at state levels. And one of the big problems is you would have to, even if you got it passed through a state legislature, Medicare for all in that state, then how are you going to have all the agencies in DC that have parts of the pie, funding pie, be it Medicare or Medicaid or Indian Health Service or whatever, on and on and on and on. How do you get that funneled into a pot when those agencies don't relate to each other, don't talk to each other, and may be threatened by their dissolution too? So I don't think I don't think it's going to happen at a state level like it did in a province level in Canada.
Well, I was in California when that happened, and it was.
I was in California when that happened with SB 562, and it was just one corrupt politician, Anthony Rendon, who took a lot of money from the insurance industry, and he just shelved the bill. But and people are actively working on Maria Estrada as challenger. But I mean, I don't know how long it's going to take with the political will. But little by little. But I mean, it was just one individual. He just kicked the chessboard after we were starting to win. I was in the room. We were changing some of the senators' minds, state senators. Some people were no, and then it started becoming yes. And then he just kicked the chessboard over. It was very undemocratic. But
yeah,
replace Anthony Rendon. But I mean,
So, John, what is your prediction on how this new Medicare for All Caucus is going to progress? You know, do you think they're going to keep their cards underneath the table until after the midterm elections? And, you know, what do you think the timeline will be between now and the new session in Congress that begins in 2019?
Well, I'm optimistic. I'm optimistic. There are more people who are talking about single payer now than in the past, and younger people running for office, especially women. And I think women's health care is going to be a big issue. The Me Too thing is a major change in our society, I hope. Anyhow, I'm optimistic that way.
Well, I think one critical thing we have to do is prevent for-profit providers sneaking in somehow to 676.
Exactly. That's a big deal.
I'm an retired RN, and I've been studying this issue since the 80s when the Clintons tried to do some healthcare reform, and I'm pretty well familiar with all of the problems and everything. I appreciated Dr. Geyman's input, and I do subscribe to the Don McCann quote of the day. And I think that's I've learned a lot from that. And it's sad that I think that they didn't allow anybody from single payer proponents to testify during the Obama hearings on healthcare, because if the public would have been informed, I think they would have generally been all for it, because they're right now being completely misinformed, and it's hard to get past that. And so thank you for your participation, and I was glad to be able to hear your comments. I don't really have any questions.
While you were talking, I was also looking at HR676, which I wasn't that familiar with. I'm actually a friend of Sally's, and she told me about this discussion, and I was interested in listening. If you already may have read it, Jeff Stein wrote an article for Vox online, and he really points out some major obstacles and issues with 676. He's not against it, but he's got the pros and cons. And I'm reading through that and finding it very interesting. And I just want to wish you guys all good luck and keep up the good fight. I don't have any questions really, but I'm glad that someone is pursuing.
Well, glad to be with you. Good luck to you all.
Okay, thank you.